Hello, everyone. I'm so glad that you're here. My name is Alyssa Norwood. I'm director of the Connecticut Age Well Collaborative, and we're delighted today to be recording this webinar to talk to you about our Community Leaders Fellowship program. So thanks for joining our information session. And in addition to myself, I'm thrilled to be joined by Randy McCrae. The two of us together are going to be doing some sharing with you today, and for those who apply and are selected to participate in the fellowship will be your co-facilitators, your thought partners, and above else with deep humility and excitement to learn from all of you, your listeners. So I want to start by telling you a little bit about who the Connecticut Age Well Collaborative is. Some of you might know us, some don't, but we are, as it says here, a statewide cross-sector initiative to foster communities where we can all thrive as we grow up and grow older. So the container for this is we're all on this shared journey, right? We're all aging, our bodies and minds are changing over time, and that means different things for different people. It might mean that I comfortably live in the home or in the community that I've lived in my whole life, and with some small adjustments, I comfortably keep doing what I'm doing. It might mean that I have a loved one whose changes have huge implications for me. Maybe I'm now in a role in partnership with them, providing some care. It might mean that my home and community no longer works for me because there's something about my mind or body that's different now. And what's next? Where do I go? Can I live in a different kind of home in the same community? Do I need to think about moving into a nursing home or somewhere where I can be taken care of? So these are the questions that we're all grappling with. And the role of this organization specifically is to help town government think about these questions so that we all have a fair chance to continue aging in place and living where we want to live. So that's the heart of what this initiative is. And when we think about caring for people and for all of us in our communities, there are a lot of great organizations and partners that have been doing this work for a long time. And a lot of the conversation tends to focus on programs and services. So making sure that I'm socially connected, making sure that I have healthy and nutritious meals, and that I'm connected to that opportunity. But we're trying to broaden the conversation, and this framework, this wheel that the Connecticut Age Well Collaborative uses, is trying to expand the conversation and say programs and services are really important. But when we think about aging, dementia, and disability, and shaping places where we all belong with or without one of those realities, that there's a broader lens that we need to use. So we need to be thinking about, I mentioned our housing. Do the housing choices that we have in Connecticut support this journey? So the vast majority of houses in Connecticut are single family. The bedrooms are all on the second floor. They require some vigor for their physical maintenance, and a different winter, we might have some snow removal. So just broadening this lens so that certainly programs and services for older adults and people with disabilities are part of the conversation, but that we're looking more broadly. And I just want to mention the photo on the right. For those of you who haven't seen this photo series, there's a professional photographer. His name is Tom Hussey, and the link here goes to the full photo exhibit. This is just one of them, but it's called Reflections of the Past. And he actually takes photographs of individuals. So this gentleman is looking at a real photograph of his past self, and through a variety of computer techniques is able to create these beautiful images. But I think they really speak to the reality that we all have, that our essence, that who we are on some fundamental level is unchanged. And there might be some sense of surprise for some of us as we look in the mirror, because who we are and what other people see might not match. So a lot of this conversation is also around honoring that essential essence, that part of ourselves that even as our bodies and our minds may or may not change, that there's a a part of us that remains unchanged. So the next thing I want to do, why is this important? Why are we doing this work? Why are we starting this Community Leaders Fellowship program is really rooted in some pretty significant demographic changes that are happening all over the world. So this idea, called the big idea in 4 minutes, not surprisingly, we'll give you the big idea in 4 minutes. So let's watch.
Never in human history have so many lived so long. Data suggests that if we reach 65 years of age, it's likely we'll live to 85. We're living longer and we're having fewer babies.
The aging society is about the fact that you have larger proportions of people over the age of 60 than you have who are under the age of 15.
And it's not just America that's an aging society. Europe, China, Japan, we're an aging globe. An aging society isn't just about old people. It's not just about baby boomers. Gen X will likely live longer, and so will millennials.
The baby boomers are an introduction to what will be a permanent shift. It is not the pig and the python, a large snake that swallows a pig, and you see that bulge going through the snake and then coming out the other end eventually. Well, ours never comes out the other end. This is a permanent state we're now in a remarkable shift.
And the shift will utterly transform our society. How and how long we work, how and where we live, how we organize our families, medical care, economic and political lives, how we organize our thinking. This will give you an idea of what's ahead. Right now, about half of us live in the suburbs, and it's where 75% of older Americans live and want to continue to live. But suburbs were designed in the 1950s for young families and the car. There's a disconnect there we have to deal with.
It's an old rule of thumb that if you can make the community work for kids and if you can make the community work for the elderly, that it will work for everyone else.
Same with how we work. We think of 65 as a retirement age engraved in stone. But when Social Security was enacted in 1935, average life expectancy was only 62, 3 years less than retirement age. Today, we can expect to live about 15 years beyond traditional retirement age.
There isn't anything in the psychology literature that suggests that it's good for people to go on vacation for decades.
Even if it were a good thing, few of us imagine retirement as a vacation anymore. Most of us haven't saved enough, and we're all worried, for good reason, about Social Security and Medicare. What if we reimagined our standard life course? We think of it now in 3 age-segregated boxes. Age 0 to maybe 25, childhood and education. Age 25 to 65, work, and more of it, raising a family, always crunched for time. Age 65 and beyond, little work, lots of rest. What if we imagined that 3rd box would start just 3 years before life expectancy today, say around 75, not 65? What if we worked less in the middle of life and longer at the end? And what if we looked at aging and even our own mortality square in the eye?
Children in American society historically have only suffered losses that relate to their parents for the most part. But today and tomorrow, they're going to suffer the losses of great-grandparents, of parents, of grandparents, and so on.
So here's the point. The world we live in, the people we've become, demographically speaking, are way different from 1935 or 1950 or even 1970. But our institutions, economies, policies, Social Security, Medicare, our communities, work, all were designed for who we were 50 years ago. They don't work for us today. So, are there rough waters ahead?
When we think about an aging society, everybody swoons. And oh my God. They write articles about defusing the demographic time bomb. Why is there an assumption there is no upside?
Maybe because the upside requires change. Change we have to design, legislate, wrap our heads around.
As a psychologist, I'll tell you the very first step that is really essential, and that's that we begin to envision new models, new ways of being, new lives.
How will we come of age in an aging America? The conversation begins.
Suggest that it's good for
You know,
people
they
to go
write
on
articles
vacation
about
for
defusing the
Large
demographic time bomb.
This is a permanent state we're now in.
So even those of you who have seen it, I hope you enjoyed seeing it again. It's powerful, right? We're in a different time and a different place than we were a generation ago, and I'm sure you each have really thoughtful and profound stories to tell about your experience as this all unfolds. So let me get us to the next slide. So I want to tell you a little bit more now about our story. So I mentioned who the Connecticut Age Well Collaborative is. So you should all know that this work isn't just relevant to Connecticut, but all over the world. People are thinking about and grappling with this. So many of you might know there's an organization internationally called the World Health Organization. By its name, you can imagine it's charged with thinking from an international perspective, what are the most important health issues that we need to think of? And back in 2007, the World Health Organization recognized that towns really needed to start thinking about this. So they launched what at the time was called the Age-Friendly Cities Initiative, and it was really focused on cities. The movement has since expanded to not just include cities, but also towns, entire states, getting everyone to think about how do we create communities where we can all experience aging inclusivity. So in 2010, the World Health Organization established a community of sorts for all of these different local governments to work together to share resources to think about these issues and how to improve. That work then came to the United States a little over 10 years ago, and AARP is still the US lead affiliate to the World Health Organization for this work. But the following year, in 2013, the Connecticut legislature passed a law that really dedicated some research and focus to this work here in Connecticut. That Commission on Aging that was the leader of that work, unfortunately, was defunded and budget cuts. The statute is still on the books, and it was just a little over 2 years ago now in 2020 that the Connecticut Age Well Collaborative was established, and effective last year, we're now leading that work that's still on the books per state law for the state of Connecticut to really be thinking carefully about how we create the phrase that they use is called more livable communities. So communities that can support everyone across the lifespan. And we've since expanded our scope to think not just about how these communities impact our aging process, but also what it is to be a person living with one or more disabilities or a person living with dementia. So, some people ask us, where do we get our funding? How is it that we're doing this work? So I want to acknowledge two key partners. One is a philanthropic foundation called the Point 32 Health Foundation. And one of their key programmatic areas is around healthy aging. So they're one of our two key funders, and we're incredibly grateful for their support. And the other is Connecticut State Department of Aging and Disability Services, which has also really deepened its commitment around this idea of needing to help ready local governments and all levels of government for these significant demographic changes. Two other partners that I just want to mention in this work. One is called Connecticut Community Care. And Connecticut Community Care, as you can see here, helps people of all ages, abilities, ethnicities, and incomes live their best lives at home. So in other words, there's choice. As our bodies change and our minds change, it isn't inevitable that we spend our time in a long-term care institution. And that might be a good fit for many of us, but there is a choice, and it's also possible to get home and community-based supports and services. So Connecticut Community Care is at the core of this work. They're also a fiscal sponsor of our organization. And then our last partner, the Commission on Women, Children, Seniors, Equity, and Opportunity. I mentioned Connecticut used to have a Commission on Aging. It was merged and consolidated with a number of other legislative commissions into one commission that recently, as I mentioned, delegated its statutory charge, this idea that it needs to be living the statewide livable communities initiative to our organization. So we're really grateful to those and many other partners, but that's who funds us. So, as I wrap up this piece and turn things over shortly to Randy, at the heart of the fellowship and at the heart of our organization is asking each of us who live here in Connecticut, what does aging, dementia, and disability inclusivity mean to you? And we're really interested in hearing answers to that question from a lot of different perspectives. So this is the Connecticut Age Well Collaborative's action plan. We're not talking about the totality of what our organization does today, but number one, the foundation of what we do is we really want to inform all of our efforts with lived experience. So not just what does research say, what do other organizations, but people living every day, all of us who are aging, have a diagnosis of dementia, live with a disability or a care partner to one or more of those populations who are on the ground living this, working with all of you to help co-create what it is that the Connecticut Age Well Collaborative does to help advance this work. And the last thing I'll share before turning things over to Randy is I wanted to talk a little bit about the difference between equality and equity. So some of you might have seen this. This is a newly developed graphic from the Robert Wood Johnson Foundation, and it shows an experience that all of us may have had at some point, and that's crossing the street. So you can see here there are 4 pedestrians with all different identities, different genders, different races, different ages, and different abilities. And in one picture, everybody can cross safely, and that's the one on the right. And in the other one, everyone can't necessarily. Some can and some can't. So this idea of equality, you can see the definition here, everyone gets the same, regardless if it's needed or right for them, versus equity, everyone gets what they need, and we determine what that is through understanding barriers, circumstances, and conditions. So in this particular instance, the community added a ramp. So whoever is in a device with wheels, which here is a wheelchair, it just as easily could be a walker, or it could be a parent pushing someone in a stroller, as well as you could see some bumps, or maybe you can't, depends on the size of your screen, but some bumps that enable somebody who's blind or visually impaired to be able to feel that they're approaching an intersection. And you can also see that there are additional pedestrian signals, the audio component that makes this accessible. So we're really deeply committed to this idea of equity and the idea that when we address structural changes, they make the community better for everyone. And we want to have a deeper sense of what's needed and what those are. So with that, I'm going to turn things over to Randy to talk more about the Connecticut Age Well Collaborative's launch of the Community Leaders Fellowship. Randy, thanks so much for being here.
Thank you, Alyssa, and thank you for that very great introduction into the Connecticut Age Well Collaborative. As Alyssa mentioned earlier, I'm Randy McCrae, and I am one of the facilitators, thought partners, and listeners for this collaborative experience. We have recently launched the application for our Connecticut Age Well Collaborative Community Leaders Fellowship Program. That's a mouthful. And so we're going to go through just some of the information that would help you gain a better sense of what the fellowship is, what it intends to do, what some of our outcomes are. Hopefully you can share that with others, or some of you on this webinar may be interested in joining yourself. So our cohort for 2023, Alyssa, if you can. So I wanted to really start with grounding us in why would we bring together a group of individuals with various lived experiences to engage in the co-creation of change in their communities. And so it really is about, sort of our framework around what this could possibly lead to. And so it's really about 5 areas on a cycle of what we call oftentimes the theory of change, right? So there's community building when we bring folks together, right? There's peer learning opportunities. There's knowledge sharing of lived experience, which, as Alyssa described at the beginning of this presentation, is really central to the work of changing our communities to make them more reflective of what people need today. But when we're thinking about equity, right, really understanding where each individual person is and what they need to age and live well in their community. So there's the knowledge sharing that we would gain from lived experiences. And what's really critical to this whole cycle is the connections to mechanisms of change, right? So with those shared experiences and with that community building, we're creating opportunities or bringing people into the places where change can happen, where they can influence and inform local policy. Also, individuals have a greater awareness of the communities around them and others and how others are experiencing the communities around them to serve as advocates, right? And they're themselves are also empowered to operate in the leadership capacity. So what this means is that when we bring these groups of folks together with these different lived experiences, through all of this, there can be change in our communities that really realizes the vision that the Connecticut Age Well Collaborative has for what they envision about creating communities where everyone can live and thrive. You can go to the next screen. So I really wanted to just share, I know we have this on the flyer for those of you who have received it or have seen it already, really what we hope to do through this experience in terms of selecting who can participate. We wanna just put some sort of qualifiers around who will be selecting to participate. So it'll be Connecticut residents or those who have been Connecticut residents within the previous 2 years. Preference will be given to applicants who are aging, living with dementia, living with a disability, or acting as a care partner with someone in one of those communities. Identify with groups or communities from historically marginalized groups. So we know based on different historical events across people's lived experiences, there's a certain group or certain individuals from certain communities who have been intentionally excluded from opportunities to engage and serve as leaders and serve as thought partners, right? And advocates for the issues that impact their lives. And so we will give preference to those individuals to have sort of a seat at this experience so that we're hearing from them, so that whatever we co-create, it really reflects their experiences. Preference will also be given to those and those who identify as low income or self-identify as low income, and that will be based on the average median income of their geographic location. So we know that different cities look different across Connecticut, but it will be low income based on where they are in their particular locale. We also want to have individuals who have a deep interest in community organizing and social justice work and are willing to share their information and lived experiences. And these are because what we hope that will come out of this experience is that more people will be actively engaged on matters that influence their lives and their local communities. So we want individuals who are going to build on this experience and take that with them to serve in a leadership role or advocacy role beyond just this particular fellowship engagement. And central to the work that we're doing is around their lived experiences, right? When we look at some of the folks who are operating in these communities or from historically marginalized groups, often the solutions aren't designed with them in mind, right? Because no one has interrogated their lived experiences. So it's really critical for us as we co-create whatever comes out of this fellowship, that it really is centered on those folks who are most impacted by the issues that happen in their community. People who aren't living well or aging well and don't have what they need, or their communities aren't really reflective of their needs because their needs have changed. Who are you? What does that mean? And what would a solution look like for you? Right. So we want to be very intentional about that conversation and whatever comes out of it. So we're going to center our work on that. What we hope folks will gain from this experience, though, is we hope that people will learn leadership skills that shape policy, about making more places, more livable places in their communities or across Connecticut. We hope people will share stories about what works well and what feels hard to them right now. Sort of what are the barriers for them to realize their vision for how they would age in their communities or community where they hope to live. The participation will require that folks engage in a 90-minute three 90-minute conversations, which will all happen virtually in the months of March, April, and May. They will be compensated for $100 for participating in all three conversations, and we will provide meals during our meeting times via DoorDash gift cards. So these are the 5 primary benefits to participating in the program, but we also hope that folks are inspired to continue the conversation and bring others into the conversation, really look closely at what's happening in their community, and figure out where are the opportunities for change.
And Randy, one thing that I know folks have asked us about that I wanted to clarify. So those conversations in March, April, and May, we have a couple of potential dates in mind, but in the spirit of really honoring and co-creating, rather than putting out dates and times and saying, here's when these conversations are happening, anybody who's selected will be invited to participate using a scheduling tool so that we can find the days and times that work best for our group. Is that right?
Yes, that's exactly what we plan. Yes.
That's great.
So key dates, most important date right now is that the application is open and has been open for about a week now. Our deadline is March 1st, 2023. So it is our hope that after you listen to this information and you get the link that's going to be provided on the next slide, you will forward that out to your networks, or maybe this is an opportunity that you're interested in participating yourself. The application is relatively short. It doesn't take a lot to complete. So we encourage people to get their applications in as soon as possible. Our kickoff session will be March 2023. Session 22 will be April 2023, and session 3 will be in May of 2023. You see that there aren't any dates here as of yet, because as Alyssa just mentioned, the participants who are selected, we will see what works best for them. We want to make sure that we are as inclusive and responsive as possible for all the different needs of the folks who may be invited to participate. So we're going to ask them, once we have that very first session, to select the dates that work best for them, and those will be our firm dates. If anyone who has a vacation or some other thing planned in these months is trying to get more concrete information about dates, and they share that with you, please just tell them to submit their applications and we will get that information out to them as soon as possible. But I would ask them not submit an application because we haven't established dates yet. So that's the guidance I've provided with one person who reached out to me directly, is just to get your application in, express your interest, because we want to make sure we have a diverse group of folks at the table. And then once we get closer to those dates, you can let us know if they work for you or which dates might work for you. So our last slide before we take questions is really around the actual application itself. We have a link here, which you can actually click right in this slide, and you'll get a copy of this presentation after, I'm assuming, correct, Alyssa? Because I've seen a couple of people put in the chat. Yes, so there'll be a copy forwarded to you. There is a link to apply. I think we can also drop the link to the chat. Drop the links to the application in the chat. So if you can access it now, you can. We have a phone number folks can call if they have trouble completing the application or they need the application in a different format. We also have our Connecticut Age Well email address that people can send any questions or requests for assistance to. We realize that maybe not everybody has access to technology, so those other two methods of reaching out to us are available, so that if there's further assistance with completing the application necessary, we will provide it. So again, I hope that you all will consider forwarding this to your networks, or some of you on this information session or webinar are interested yourselves, and get that application in as soon as possible. And we look forward to hearing from you. I'm going to turn it back to Alyssa for some final words, and maybe we'll have time for questions.
Thank you so much. Well, I'll begin by saying we advertise this as a 30-minute session, so we want to honor everyone's time. Anyone that needs to sign off, by all means, feel free. Thank you so much for coming today. Anybody that has questions, we're here and we're delighted to answer them. You can ask questions in one of two ways. You can either use the raise hand function and we'll unmute you if you'd like to ask your question by talking. Another option is you can put your question in the chat. So I see our first question. Denise, why don't you go ahead? So you just need to unmute yourself.
Hi, thank you. I'm interested in knowing if this involves a long-term commitment, if that's what you envision out of this.
It's a great question. So we recognize that everybody's going to make different choices around what feels like a good level of involvement. So the initial commitment for participation, as you saw from Randy, is participation in 3 sessions. At the end of that time, people will have a choice to either say, you know, I found this valuable, we hope that's what they'll say, or I didn't find it valuable, and walk away from the opportunity. But we're hopeful that there'll be a long-term committed core that wants to continue participation. So the second phase of the fellowship, which will begin in the summer, is going to be designed to do a couple of things. One, it's to invite folks who are interested in long-term leadership. So the Connecticut Age Well Collaborative has a steering committee that makes decisions about its long-term strategic plan and vision and what it does and what it should ideally accomplish. So the goal is to have a group of people with lived experience get whatever skills they articulate are needed to be able to successfully participate as members of the steering committee. So that's one longer term goal. A second longer term goal is, some of you might be familiar, but our organization has an educational series called the Age Well Academy. And the last of the events in that series in October is an event about honoring lived experience and building community authority. So over the summer, in the second phase of the fellowship, the group of people who choose to continue will be developing content with support from me and Randy and other partners to tell mayors, town managers, other local elected leaders and staff what, in both the estimation of the people, our cohort decide, and also based on some literature, municipalities ideally need to do to really authentically engage the community. So the short answer is there's a short-term commitment now, but there's a longer-term opportunity.
Great, thank you.
Thanks, Denise. Any other questions from folks? Well, thank you so much for being here. If other questions come to mind after the webinar, you can email us at ctagewell@ctcommunitycare.org, and we'll also be posting a recording of this event online, which feel free to share with others who couldn't make it here today. Any last thoughts? Okay, well, best wishes to everyone. Thank you all for coming today. And Randy, thank you so much for lending your passion and your expertise to this project. We're really excited to be developing it.
Thank you for having me.
Okay, thank you so much, everyone. Be well.